Hello, everyone, and welcome to this month's Public Health Plus session, Public Health Plus Private-Public Partnerships. My name, as Diego said, is Michelle James, and I am the Senior Director of Alumni Engagement for the Rollins School of Public Health at Emory University. The Public Health Plus series was created by the Rollins School of Public Health's Alumni Board Career Development Committee in partnership with our good friends at Orange Sparkleball to examine the spaces where public health intersects with other disciplines, discuss their work, and then hopefully broaden our thinking. Public health is unique in its ability to span across multiple institutions, from government to nonprofit to startup and academia, with each one of them offering a different perspective and methodology for approaching public health challenges. But by building partnerships across all of these entities, we can more effectively address and solve our most pressing public health issues by leveraging one another's resources and expertise. Today, we're going to talk about those partnerships, and we are honored to have Maria Thacker and Ken Berta with us to talk about their work and all the ways in which they're building these partnerships to advance public health. Alexa Morris will facilitate our discussion. So let's meet our speakers and facilitator today. Alexa is the Director of Commercialization Programming at the University City Science Center. She joined the team in January of 2021 from the Global Center for Medical Innovation, where she managed their accelerator program and business development operations. In this role, she worked with a variety of stakeholders to accelerate med tech commercialization. Alexa has previously held roles at the Centers for Disease Control and Prevention, ShareCare, Startup Health, and Athena Health. She is currently pursuing her Master's of Business Administration from the Scheller College of Business at Georgia Tech in the Thacker, which is Technology Innovation Generating Economic Results Program. Alexa is one of our very own Rollins alums. She earned her Master's in Public Health from the Rollins School of Public Health at Emory and a Bachelor's of Science from Furman University in Health Sciences. Ken Berta started his career as a VA researcher, surgical technician, and medical device designer. He quickly rose to become head of global R&D for Furno, Washington, one of the world's largest private manufacturers and distributors of emergency medical products. After serving as the general manager of global operations for YSI Life Sciences, he then turned to public service to start the nonprofit Wright Center of Innovation for Advanced Data Management and Analysis, which is now renamed Data Ohio. With over 30 years of healthcare technology, strategic consulting, and venture capital experience, Ken has designed and launched dozens of products, been awarded 5 international patents, and started 7 companies. He holds a degree in biomedical engineering from Wright State University and an MBA in international business from the Williams School of Business at Xavier University. Maria Thacker is the president and CEO for Georgia Bio and the Georgia BioEd Institute. She has helped build the organization into one of the top state bioscience and medtech associations through her community outreach and engagement, member development, and leadership in increasing community connections and resources. In addition to her work with Georgia Bio, Maria is also the executive director of the Georgia Global Health Alliance. The Alliance strives to advance global health equity by promoting and facilitating collaboration among business, academia, nonprofit, and government organizations in Georgia, and then linking them with partners across the US and in other countries. Maria received her Master's in Public Health and Health Education and Communication and Maternal and Child Health from Tulane School of Public Health and Tropical Medicine, and her Bachelor of Arts in Environmental Sciences from Sweetbriar College. We are honored to have them with us today, and I'm going to go ahead and turn it over to Alexa to start our discussion.
Awesome. Thank you so much, Michelle. Excited to be here, especially as a Rollins alum. And before we dive into questions, just want to let everyone know, feel free to put any questions that you have in the chat. I'll be monitoring them, and then we'll have time to answer them at the end. So I will be asking Maria a couple questions, and then she's actually going to flip it and ask Ken some questions. So definitely going to get some interesting information about partnerships out of today's webinar. But Maria, starting off with questions for you. Can you go ahead and start off with sharing a little bit more about you, your background, and career path?
Sure. I mean, it was just covered a fair bit, but I'll kind of plug in a bit. My career path has been very odd. I'll be candid with everybody. When I was going to college, I thought I was going to end up being a high school English teacher teaching Shakespeare. So my career trajectory definitely made a pretty hard pivot. I started school in New York, but ended up transferring and landed at Sweetbriar in rural Virginia, which was an outstanding experience for me personally and academically. Was able to be the first graduating class in the environmental division, and now the school has a very robust program, including a massive dairy farm and all these other sustainable practices they do across their nearly 3,000 acre campus. So it was a great experience in that particular degree program, even being able to be the inaugural class for that particular degree. From there, I came back here and had a fascinating one-year ORI fellowship with the CDC, specifically over at ATSDR. Working for the now COO of CDC, Sherry Berger. It was really interesting. I worked in the chemical demilitarization unit at CDC and learned some fascinating and scary things at the same time. But it was really interesting. I was able to work with a team developing the long-term protocol on anybody that may have been exposed to any of the chemical agents. So it was a really great experience. But at the end of that experience, we finished the research a bit early, and they had me start to participate in some health communications projects and attend some health fairs in the populations and the communities we were working in with the ChemDemil team. And I got really interested in health comms and trying to improve communications to the layperson on the practice of public health and elevating the work of public health within communities and the value it brings, because often it goes unrecognized. So from there, that's when I got sparked into my degree to get my public health degree, which my father, who spent nearly 40 years at the agency, kind of smirked at because I'd always told him I'd never follow him in his career path. So he definitely got to rub me for that one. But I ended up getting the same thing. I did point out I didn't get my epi degree. He was an epidemiologist. So, but it was a really fascinating experience going to Tulane. Quite frankly, the only reason I went to Tulane is I liked the town. It was that or Boston. Those were my top choices, BU or UMass, and it was just too cold for me, frankly. So had a great time at Tulane and had planned to move to Colorado, and ended up Hurricane Katrina made the decision for me to come back to Atlanta. So nothing like a massive life-changing hurricane to make decisions for you. But it's been a blessing, and it's been great to end up in the biotech space. Being pushed back here unplanned, you just start looking for a job, and quite frankly, it took a little bit, but CDC was on a hiring freeze at the time, and I had a friend at the agency say, hey, there's this biotech nonprofit. I don't know what they're doing, but they need a marketing person. You could probably do it. And I applied, and 15 years later, I'm still here. So it's been a fascinating path. It's been great to be in Atlanta, being a rare unicorn native here, and helping to grow our innovation community in the health space.
Awesome. Yeah, that's a great career path, and especially winding career paths, I feel like are usually the best.
It's definitely random. I know.
That's awesome.
Yeah.
But all connects. So that's great. Would love to hear a little bit more about your current role, especially before we get into talking about the Center for Global Health Innovation. What is your current role? What do you do?
So it's a bit of a running joke. I have 4 job titles. But frankly, so my core role is President and CEO of Georgia Bio. I've been doing that. I've been in that seat for about 2 years now this month. Georgia Bio is the life sciences trade association that supports the life sciences sector very broadly. So that's everything from medical devices, that's how you and I know each other, Alexa, and to the biopharmaceutical side of things. But we are also scaling our membership in the food and ag and industrial and bioscience spaces, especially as bioplastics and other sustainable products really become more important to our communities and our environment. So we have a strong relationship with Emory, I will say that. Work closely with the Tech Transfer Office and a gentleman named Mike Cassidy, who works as a biomedical catalyst within the university. So we really do our best across our research university system here in Georgia to elevate the importance of research and how it complements innovation for our private sector company members. A lot of companies do look to universities for their pipeline. Also, Georgia Bio, about a decade ago, started a institute to help improve our workforce needs in the life sciences sector. A lot of that is in the manufacturing space. We are one of the first 5 life sciences institutes that was stood up in the U.S. and are one of the longest standing and largest ones, actually. Last year, we brought life science career pathways to over 11,500 students in the state of Georgia with through our public-private relationship with the state of Georgia. So the state provides us a little over $300,000 a year, and the industry matches it with equipment and training and volunteer time and education and dollars in order to make sure we're exposing young people, especially in underserved populations, to careers, STEM careers in the life sciences very broadly. And that does include public health. So we're excited. We're in our second year, and hopefully the Senate will, in the next week, definitely approve another renewed round of funding for us that we get through the Department of Education here in Georgia. So that's one example of a public-private partnership that didn't even cross my mind until I started talking about it. A few years ago, I was asked to help start up the Georgia Global Health Alliance to better connect our global health community here and our organizations. As most likely everybody on this call who's in public health knows, Atlanta is a hotbed for public health. And our most recent survey does show us as being one of the largest, if not the largest, workforce in public health on the planet. So this was really about connecting people, educating people, and bringing people together. It is going through an evolution as we speak. So I'm anticipating by this summer, our organization as a whole is going to look very different. And I hopefully have a few less titles, quite frankly, so we can be more clear on how we communicate so we can enable our partners and members in achieving their missions. But I'll talk about the center and how I became CEO of that in a second. So yeah.
Absolutely. Yeah, that's actually a great segue. Sounds like you guys are doing really important work, and partnerships are a key part of that. So yeah, would love to have you hop into talking about the Center for Global Health Innovation. What does that look like, and what all do you guys do?
Sure. So yes, the center really is, quite frankly, I've been a bit in the middle of all this, thus all the titles, and we were really trying to find a way to break down the silos between our life sciences community, our global health community, and our health technology community. We have a very strong tech community here, especially in Atlanta. It's one of the largest in the country. And a good base of that is in the health tech space. And of course, our global health community, our public health community is very strong, Emory being, a big reason for that, along with the CDC. And then our life sciences community has been one of the fastest growing industries in the state, and it's one of the most high paying, and we're one of the largest in the Southeast. So, and we all work together. If the pandemic has taught us nothing, is that we all need to collaborate and work together. And if we can find a way, not only just to connect each other via events and emails and things like that, but a physical place to make those connections more effective, we wanted to do that. This is not a new idea. Building a space, a center, an innovation district, whatever you want to call it. There are many people that came before me that have worked towards the same vision. I think, quite frankly, the stars have aligned. So the center is really, it's a place. It is a place, it's a connector, it's a convener, and it's also going to be an accelerator to allowing these three core areas in the innovation space and health to come together more effectively. It will be the first innovation district to intentionally include global health and public health at its core. We want to approach this as a problem-based innovation space. And a lot of those problems are seated in public health and in global health, whether I'm working with a specific patient population that's affecting their community. So there's all sorts of connectivity across the three spaces that we're really hoping this can not only elevate the ability for people to solve problems, but thereby also being an economic driver for our community here where we sit in Atlanta and across our entire state and region, quite frankly. We can elevate our partners even at Augusta University and at Mercer and across the region in the Southeast, and even some of the work we're doing, as Ken will speak to later, is working with partners in the Northeast and out West too. So any way we can connect her and be a main node, as one of my board members likes to say, to connect the dots so people can collaborate and more effectively partner, that's what we want to be, and that's what we're working towards. We already have brilliant global health experts in our community. We have powerful government agencies with CDC, but also our relationships with other agencies we've been building over the last few years. We have a lot of influential NGOs. And corporate partners and corporations like UPS and Coca-Cola. I mean, they do research. They're core to the response right now. Supply chain logistics, as Ken will talk about, is really, really important to this response. That's how we're getting vaccines to people. And then, you know, people like Coca-Cola do a ton of R&D in the plant-based sciences space and the bioplastics and all that. So there's all these different corporate partners too, along with the governments and the NGOs and the academic institutions that really can and already do work together. And then finally, if we can find a way, we want to find a way through the center and the place to be a place where entrepreneurs can come together, and we can educate our academic partners that may have an idea on how to understanding what commercializing your technology might mean, and have a mentorship program and a training so we can walk them through that process in partnership with their tech transfer office and their university, of course. So we're really a connector and an economic driver for our community here.
Awesome. It sounds like you guys are the perfect organization to serve that node role, especially at the center of it all and really connecting everyone. So I'll pass it to you if you want to share any more about the Center for Global Health Innovation, the structure of it, or if you just want to jump right into questions with Ken. But I will pass it over to you. So thanks again, Maria.
Sure. So I will share one slide, and I apologize, I'm flipping here, just so people can visually see. We always find this very helpful, and please bear with me. I learned a fun new key trick at the beginning of this call. So let's see here if this works. So Alexa, is this showing properly?
It is showing the outside borders as well.
Oh, okay. See, your technology is not my strong suit. Well, it's fine. So we are structured right now as one 501c3 nonprofit. That is really what we spent the last year doing. We officially merged at the beginning of 2020, right as the pandemic was hitting. And we are really bringing these organizations that I work together to help run in partnership with our boards, of course, together to help break down those silos. Like I said, life sciences, which is Georgia Bio, which has a lot of as part of a national network, our Global Health Alliance here in Georgia, our STEM Institute, which was under Georgia Bio, but is really peeling itself out and just finished a strategic plan and is going through a rebranding process. And then our newest division, who we're featuring today, the Global Health Crisis Coordination Center, which is really about harnessing the capabilities of the private sector and our NGO world and using that in order to combat global health crises. I will say that this GHC3 was birthed out of something called the Global Health ATL initiative 3 years ago this month, excuse me. There was a partnership with Deloitte and the Metro Atlanta Chamber and the Global Health Alliance as an economic driver. This original disaster team, which we had many partners across our community help blueprint, is what birthed the GHC3, and Ken will speak to it. And then, like I said before, the center is a physical place, it's a central hub to connect these silos. So I just wanted to stop share. I just wanted to kind of show and visualize everything we're representing and how we're trying to connect people. We're really trying to build long-term impact with our work at GHC3. We have a unique capability to really drive and a vision to improve, connecting these different industries to improve lives around the world. Atlanta has a unique capability. We've always had the right ingredients, and we're hoping this time we're really definitely going to bake the cake the right way. We've been quick. We are activating very quickly, and we're very grateful to our board and our community leaders and the support for where we're at. But it is a first of its kind hub, and it's going to allow for collaboration, discovery, and invention, and uniting the leaders across these three sectors. But with that, I'd like to really pivot to GHC3 and talk about some public-private partnerships. Like I said before, I've been involved with some with our institute, and that is definitely a public-private partnership, which is affecting kids across the state of Georgia. And but our GHC3 in it has done so much in so little time. It's really quite impressive. But to kick us off, I think it's really fascinating to have Ken talk a bit about his background, because he has a bit of a winding path across his career as well. So Ken, if you don't mind talking about like how you got here and your great experience, and just how you ended up with us.
All righty, thanks, Maria. I appreciate it. And you heard some of my bio early on. I really started in research, moved into corporate research and development, and then moved into business management and investment and acquisitions, and then into some private equity. But at that point, I looked at how can we really develop the nonprofit side of the world. How do we build these governmental partnerships? I was working with the Air Force Research Institute, or the Air Force Research Labs at Wright-Patterson Air Force Base. And the state of Ohio had put together something called the Third Frontier program on how to create high wage, high-tech jobs across the state. And as we look at how do we recruit talent and capabilities into companies, how do we work directly with some of the universities that we have, and also bring the technology over that these students had been working on during their career. The Wright Center of Innovation really was a part of the Third Frontier program, which was 60 companies and 5 universities that we put together to figure out how we could innovate locally. It was really around regional economic development, but it started to draw in far broader partners than that. Procter and Gamble, NCR, a lot of big companies, Walmart, Walgreens, a lot of folks that really wanted to see how technology could be applied in medicine, defense, and even in the energy sectors, looking at big data and large platforms. So it was really a centrifuge of how do we work with both the universities and the federal government with our private sector partners to really develop new technology that can be absorbed quickly into these companies to generate jobs. And that transition of basic research into innovative development into marketable products was really what we focused on there. And that drew a lot of interest from many different parts of the world. In that time, I started working in an area called confocal microscopy, how to really look at pathology images in a different way, and started working with a company that you all probably know, Philips Healthcare. I spent the last 10 years at Philips Healthcare, starting their digital pathology business. So as we started talking about how this technology, which was new to the world, can be launched, I spent the first couple of years working out of Amsterdam and in Eindhoven because Philips is a Dutch company, working with them to finalize the product, and then took over as the head of commercial operations for North America to launch the business in the biggest healthcare market on the planet, which is the US. As that grew and went through the FDA clearance and all the things that you have to do to bring a new product to market, the division was starting to move into the bigger Philips corporate engine. And that's when I said, well, okay, I'd like to start something else. And got caught in between by some of the leadership of Philips to say, hey, we need to really look at how we can do better partnerships and alliances with our strategic partners. And so I took on a role to lead the Strategic Alliance and Partnership Group at Philips. And in that process, started working with Emory on what Emory calls the Emory Innovation Hub, which you guys may have heard about. And in doing that, which was really a way for large corporations like Philips and Stryker and Cerner and others to join, and ShareCare, to join forces with Emory to look at how we could build focus solutions for early deployment. Was introduced to this whole idea of the global health ATL, or a 911 for the planet. And then I met Maria and started to really understand, as she mentioned, the power of the region in public health. What a group of assets that are there in one area. And this started to make a lot of sense to me on how, just from my Philips chair, we could leverage this community to really look at how we could focus on global health. And since taking this position as executive director, it's really amazing the community that is in Atlanta. Even working with a global corporation like Philips and saying, oh, well, we want to do some work in Africa. It may take me, even though we had a facility in Africa, it still might take me several weeks to put together a team that knew about healthcare delivery in Africa. Here in Atlanta, I mean, it'd take me not even a week to find 5 people that have 20 years of experience in delivering healthcare in low and middle income countries around the world. That's the power of having such a community in Atlanta. And then with the corporate support that Maria and her team were able to pull together to really build this out as not just a public health focused effort, but a community focused effort, where these companies like Coca-Cola and Microsoft and Verizon and the partners that we have now in the center to look at how we can align with them to move public health in a positive direction, it has really turned into something that I think will have global impact. Oh, you're on mute, Maria.
Sorry. got muted by somebody. Yeah, no, thank you, Ken. That's really great. I just think, how you came to us is just really fascinating with that core directive initially from Phillips. I think it's important for this particular audience that I point out is from a center perspective, we're defining global health extraordinarily broadly. I know, having received my own public health degree, that there is a classic way of defining public health. And I think we really lean into Dr. Copeland and others' definition within the Lancet, that it really takes a collaborative across a variety of multidisciplinary sectors to really achieve health equity. So I just want to make sure it's very clear. So when we're defining global health, that's why we really are embracing the private sector and things like that, and what a lot of Ken's about to get into. So that being said, Ken, how has GHC3 been able to leverage private sector partners in a way that focuses on the equitable delivery of public health? This, if you want to touch on a few of the programs, I'm sure it'd be really valuable for the audience.
Sure, I will. And let me throw a few programs up here to kind of highlight how we've jumped into this area. Hope you can you see that now? All righty. So, I'll go through just some quick examples since vaccines are top of mind for a lot of folks right now. Here's some programs that we were able to put together quickly. So when we look at challenges that we may have, and our initiatives really are to find ways to supplement the government's activity to either speed its impact or enhance its results by pulling together private sector resources and filling gaps that we may find, or enhancing capabilities that the government has developed. And one of those examples is the PAVE tool. PAVE is a vaccine equity tool, so that when public health officials receive their allotment of vaccines for their state or their county, they have a data set and a tool they can use to show how those can equitably be distributed. So how many people do we have in these age groups with these mortality and morbidity concerns, with these in these ethnic groups? How do we break down how those at highest risk can make sure that they get the vaccine first, and vaccine where it's needed? This was really based on the National Academies of Medicine model and the CDC playbook. And what we did is put together with our friends at Microsoft a capability to align population data, and both from public and private sources, to say this is how many people we have that are 65 and over in nursing homes in Fulton County, for example. And so as a public health official, you understand this is how we can put this together. And we were able to leverage a lot of the work that Microsoft was doing in their Dynamics platform, which is really how do you market individually to folks. They use that to leverage business. How can we turn some of those capabilities that our companies and our company partners have into public health tools that can make that work? And the team at Microsoft, very focused on healthcare right now. We're happy to jump in with their senior architects to say, here's a way we can put together and manage this data. And then how can we work with the states and the CDC to fine tune this tool? And then we rolled it out to all 50 states and 9 territories so they can use that tool when they get their alignments or allotments. So in some cases, it is finding those partners' capabilities and how they can be applied to a challenge that we see. Sometimes in the innovation arena, we have something called a solutions gallery where new innovations can come into GHC3 and we can post those. So folks that are looking for a new technology that can electrostatically clean a room or purify air, or in addition to an HVAC system, AC system, or data collection devices, new biometric devices, we have a place to share those innovations and be able to foster relationships between those who need them and those who are creating them. We have another very broad partnership, and it again leverages tools in the market very similar to what an Ipsos and a Rewe and a Twitter have in their capabilities to very narrowly target messaging to a very small subgroup of the population. This is called COVID. It's a program that was developed with the CDC, and we're right in the middle of pulling this together on how we can deliver very focused messages through continuous research and surveying, and using AI tools around sentiment analytics to see in these populations, is a message around vaccine hesitancy or reduction of vaccine hesitancy actually taking hold. These tools exist in the broader, business community already. This is how Twitter does their business, and this is how Facebook works. Can we now start to apply these capabilities to public health messaging in a way that it can change behavior? Because really, that's what we're all about in public health: is how do we take guidance developed by a CDC or a WHO and move that into policy, and those are really where the guidance tools lay out, into behavior change. How do we follow that path and leverage tools that exist today to make that happen, and then find out how we can fill gaps with innovation? So these are a few of our programs on the vaccine side, and we're about to launch yet another set of those locally in Atlanta. We also got into specific problems that we look at prioritizing from our work with the CDC to say, where is the guidance starting? So as schools shut down about a year ago now, there wasn't a lot of focus guidance on how to reopen. What can we do? So we started a project in our back to school group around getting one school reopened. It was the KIPP Academy in Woodson Park. We pulled a lot of corporate partners together to look at how we can get a school reopened, build a bill of materials on what it's going to take. A lot of these companies donated time and ingenuity and product to get this school reopened. And we were able to create a playbook from that we then could share with the nation. And that playbook is now on the NIH's site called whentotest.org. So a lot of this work has really been moved forward. We had another group back to work as businesses were starting to look at how do we reopen. They were looking for advice and guidance that really around testing and now around vaccines that didn't exist yet. For example, can we require our employees to get vaccinated? And if we do, what kind of systems do we have that we can put in place to track them? So rather than waiting for the CDC to come out with specific guidance that might help them, we put this group together to start talking about, what do you want to do? And maybe we can share information back to the CDC on what's possible, what's plausible, what are the legal issues around requiring a vaccine. Is that something a company would want to step out and do? Mandatory testing, for example. And there's a full spectrum of that. Verizon, is one company who was looking at, we have a health system in place, let's leverage it and see if we can use our current providers to deliver testing, versus an Amazon who built their own CLIA labs and started testing everyone at 650 different sites around the country. So there is a full spectrum there. And that as we started to have these conversations, and Delta, for example, also had specific needs to test its flight crews immediately. So how can we set that up and then take those issues and concerns and feed those back to the CDC so they could provide better guidance around how to move this forward and move everyone forward? So those are just a couple of examples on how we started to engage our partners.
Yes, I'm on mute still, sorry. No, that's great, Ken. Thank you for touching on a handful of the projects. And, I think segueing into the next question will be important. I just want to add, none of this is easy. You're really a community organizer in many respects. So it takes a lot of persistence and passion in order to move things along. I spent 3 years on the Global Health ATL project, and there are 3 core teams within that, and we had over 200 volunteers across our community, from the academic institutions to industry to corporate partners and just general community leaders that have nothing to do with the health space, really trying to rally the troops. And that says a lot about what GHC3 has done in a short amount of time. So you're having to rally people virtually, which is even harder. I was able to drive somewhere, knock on the door, and harass them until they said yes. You're having to do this virtually. So can you talk about some of your roundtables? I know the roundtables help catalyze a lot of the projects you just touched on, but you've got private and geo-sector roundtables, and based on the conversations with them, can you speak to more about their needs and what the opportunities for collaboration and innovation might be?
Sure. Some of the early on conversations were really about what do we do now? I mean, from a business roundtable perspective, what's next? A lot of folks didn't have a pandemic playbook sitting in their HR department on how they were going to move this forward. So we started with how can they help their own employees deal with this pandemic? And that had to do with how to best share information, how to develop town halls, how to really work with their employees on maintaining safe mitigation techniques within the facility for those who had to work, and working with those essential workers all the way to those who are now doing most of their work at home. And there are mental health issues with that as well. So talking to them about what their needs were really drew them in. Start listening first to find out what do you need. And as the group started talking, they would bring up, hey, I need to know how to do this. Somebody might have a solution, but it was very limited to their business. So then we could look for innovative companies outside of the group and say, let's present this capability, right? And maybe this is something that we can try, not to promote that specific business, but a specific type of technology that may be able to help. And a lot of that had to do with communications. How do we put information in the hands of people, whether it's our employees or it's the general public, on how to interface with us as a business? How can we put that together? The churches were a little bit different. Our back to worship category, all the faith leaders from synagogues and from mosques and churches around. We started really in Georgia, but it expanded nationally very quickly. Looking at initially, how could we solve the problem of reopening houses of worship? That turned into, well, you know what, we're doing pretty good with our video services. So what other things can we work on? Well, this became a conduit for the messaging side of when to get tested, why to get tested, how to stay safe in your home. These are things that the faith leaders were willing to share with their communities so that we could move information to them. And then once we got to realizing there would be a safe and effective vaccine delivered in a relatively short period of time, can we work with the houses of worship to look at how we can do messaging from them? Have faith leaders actually take a vaccine in front of their congregation, for example, to just promote the safety and efficacy of these vaccines. And that has become a very trusted voice for us and an influencer to move into accurate public health information delivery, which is always a challenge. We're always looking for that trusted partner, and trust is one of those key elements that we look for. On the school side, there were plenty of school superintendents who were looking for advice and really specifics. In crisis, a lot of folks, want to know exactly what to do. I don't just want guidance. I want something in my hands. I can say, do this, do these 5 things. And the sooner we can get that to them, I think the more comfortable they feel. So with the schools, we developed that checklist and back to school playbook that we could put in their hands and say, how can we move this forward? And that drew their vendors, the people they work with, to them in a way that they understood what they needed them to do. So what do I need my HVAC, I have trouble with that today, HVAC group to do when they come to my school? Well, here are the filters that the playbook talks about. Can you tell us how to work with that? And it gave them some background into how to work. So a lot of that is communications when you're engaging these groups. The NGO roundtable was a whole nother experience, in that the nonprofits don't tend to work in big groups together. There are overlaps in their missions, so a lot of times they just want to stay focused on what it is they're doing. But when you have a global pandemic like this, and you're having folks like the Red Cross and the International Rescue Committee, the foundation, a lot of the CDC Foundation, a lot of the big nonprofits can come together and say, what do we need? What supplies don't we have? How can, you're talking to these companies, maybe they have things we can use in our community sites. How do we now start to put together and that's one of the big C's in our name is coordination. How do we put together that private sector capability with public sector need? And just getting the NGO roundtable moving and getting these organizations talking to each other, they started to realize, wow, I didn't know you did all that. I need that. Can you help me with that? And it started a very good positive discussion, and that will continue to grow and move forward. So.
Thanks. And I know we're coming up on time,
Yeah.
Alexa, but I wanted to get to one other question. Apologies, 2 seconds. I think it'd be really helpful to hear more about maybe some guiding principles and even touching on any challenges you've had to overcome while working on some of these public-private partnerships. You know, well, yeah, that pretty much covers it. I don't want to get into too much detail.
No.
So if you could.
Yeah, some of the challenges are, you know, there's always competition, right? When you're working with multiple companies that do the same thing, having Dell and IBM and Microsoft in the same room, it can, you know, they all want to talk about what they can do, and you have got to back that off into, here's the North Star, here's what we're going after, and you've got to do some work in advance to say, and here's what I need from you. I need to focus on this. What here's the problem. Help us with the solution. Not something you've already got in your bag, right? But which is fine if they do have something directly for that. But let's put this together as a group. How would we solve this problem? So rather than getting in too high into corporate leadership, we fell down into the architects, the developers, the folks that really attacked individual problems, and that seemed to spur much more discussion around, hey, I've got an idea on that, or I didn't even think of it that way, and having these folks innovate together. So joining together around some specific purpose and being fairly regimented in what you need from them. And one of our mantras is no unnatural acts. How do we keep companies in their lane? To say, we're going to align with what you are good at and what you are capable of, and the assets that you have on the ground right now, to make partnering easy for you. Rather than saying, I need you to go in a direction I want you to go in, let's try to align in where you're moving, and then have you included in the project in that line, in that lane. That alignment is very important, and especially when you have, you know, 50 different companies trying to solve a problem. You need to be very specific about what you expect their role to be and how they can work together in a collaborative effort to move that forward. Trust, you know, being a trust and very open, transparent environment is also key to how you pull these folks together, so that they know all the cards are on the table. Here's what we're trying to do. We know we've asked you for your help, and if you can help, that's great. If you can't, that's okay too. Right? Maybe you'll be back for another part of the innovation, but maybe not. Anyhow, it does come with its challenges. In public and private partnerships, you have the longer view of the public network that looks at, you know, solving longer term problems. You've got the immediate need for sustainability from the business sector and from the private sector, putting those two together. So you get over the bureaucracy by moving faster with innovation, because the public sector has a real hard time innovating. How to put those two things together really starts to make some sense. And unfortunately, working with the government, you have to create a space outside of the government to do a lot of this work. And that's what the center is all about, right? The Center for Global Health Innovation is going to be that outside the fence, I call it, capability for the government to meet, discuss, innovate, develop solutions, even run pilots where that would be very difficult to do within a government environment.
Great. No, thanks, Ken. And I think this is a great point to transition into Q&A. So I'll be Alexa here and say, everyone, please submit any questions. Trust me, we've had a lot thrown at us over the last 12 months. You know, the COVID-19 pandemic has really created unforeseen and urgent challenges from day one. It also demonstrated an unprecedented opportunity for creativity and innovation. And we were already standing up GHC3 and had been blueprinting it for a year. So it was an opportunity for us. The pandemic will end. What will not end, as we all know, are health inequities, disease burdens on patients and communities, natural disasters, and other major global crises. And we believe that the center is uniquely positioned to complement and catalyze our partners and members and broad community as we work towards improving health equity and addressing crises across the world, simply by leveraging our strong and cross-sector networks and science-based innovations, of course. So if I ask you to take anything away about what the center is, we are working to connect, convene, educate, and advocate. I didn't bring up advocate a lot, but that is a lot of what we do is policy work at the state and federal and local level. So we're a neutral convener of domestic and international leaders in research, policy, and business. And the center has that unique capability to drive and a vision to really improve countless lives around the world. So we're here to help students in the long run too. We work and partner with all of you, and I look forward to taking any questions. So Alexa, I'll hand it back to you.
Awesome. And yeah, thank you for the insights, both Maria and Ken. I see that it looks like we might have one question in the chat. What I will say though, I will monitor the chat, but if you do have a question, feel free to unmute, share your video if you'd be willing, and feel free to ask. But we can take the one from the chat. Can you talk about showing results and how that might be different by sector? Because each sector needs to see success, but might conceive it a little bit differently.
Ken.
So for me, results is, how many vaccines did we get into arms in a certain period of time? Were we able to modify behavior to keep facilities safe? And so understanding the activity of the virus in a certain space. If we're looking at metrics for the public sector, they aren't as stringent as those on the private sector, because the private sector is looking to its own profitability to continue to do good work. So how do you put those two things together in looking at how many lives can be impacted in a positive way, so that we are reducing everything from transmission rates to disease rates to mortality and morbidity rates on one side, and we're getting services to those communities that don't have access to them right now on one side. That opens up markets for the private sector, and being able to tie those two things together with, here's an ability for you to move your product, service, capability forward in places where they don't exist, that doesn't exist today, is always something that the private sector will gravitate towards. So yes, metrics are very important. I hope that answered your question.
Yeah, and Megan, feel free to unmute if it did not, and clarify any parts of your question. Anyone else have any questions?
Alexa, do you want to touch on your question?
Sure. Yeah, happy to jump in with the question. How has the pandemic?
Sorry.
How has the pandemic overall changed public-private partnerships? Has it made it easier, more challenging? Can you speak a little bit to that?
For me, it's made it a bit easier because you have a single point of focus. And I don't know, Maria, you can chime in here too, but for me, it has put everybody in the path towards one goal. And that galvanization always seems to bring partners together quickly. Maintaining them is going to be the challenge over time.
Yeah. No, I would agree with Ken. That's what I was going to say. I think it's presented an opportunity, and we definitely have harnessed that with GHC3, but how we move past it and maintain the level of collaboration we've definitely seen in the private sector in terms of vaccine development is going to be an entirely another question. Putting my bio hat on, I would say that is the big question. I think the industry is intent on maintaining the relationships and the opportunities for collaboration, but having this, having COVID, a global pandemic, certainly forces collaboration, but it also presents us all with other challenges, whether that's, we're seeing all the challenges that it's putting on the public health infrastructure and our health system in general here in the state side of things. That's one thing that I think many of us knew about, but now it's at the forefront of what we do from a policy perspective. We've changed our narrative in the life sciences private sector to include advocating for public health more effectively and more directly. That was not happening prior to the pandemic. So there's opportunity, but it also presents new challenges, but thereby new opportunities too to continue to collaborate. And hopefully the lines of communication and the level of cooperation continue to move beyond the pandemic. I mean, and the reality is, the pandemic, even as we come out of it in the next year, sorry, I'm going to be very vague here on that number, in my opinion, it's still going to be with us. Coronavirus has always been with us. So it's how we live with it and maintain the relationships moving beyond it.
And I do think that this virus this pandemic has really shown a light on inequities, and that will be carried into some of the work that Maria is talking about. For example, we're doing a lot of work around messaging and message delivery, and finding ways to work with specific communities. part of the development will also be, how do we get more diversity into our cohorts for drug development? The same type of messaging and participation and requirements are starting to pull that together. So the tools that we're building now can also be useful for other events.
Mm-hmm.
Yeah,
and that might be. I was going to call out that question. That's perfect, Ken. To Anindita's question, she'd like to hear more about our fight against misinformation and the strategies we're using for the COVID project.
Yeah, there's we've been working a lot with the UK's vaccine misinformation team as well, because this is a global issue. But it is, how do we look at putting strong peer-reviewed science up against any of these claims? So most of what our partner in message development that's done a lot of work, 10 years of work in this space, Johns Hopkins and Dr. Dan Salmon and his team, looking at how do we then pull apart those arguments and put real science up against them and say, we're really not trying to convince you that that's wrong. We're trying to give you the information to make your own decision on what's right. So a lot of what we do on vaccine misinformation is really looked on how we can inform in a clear, trusted way to start to tear down some of the misinformation that's out there. It's hard, though. I will tell you, in today's, Twitterverse, it's very difficult to fight against, I heard this, and because there isn't a lot of folks asking, well, where'd you hear that from? Why do you trust that source? And how is that impacting your thinking when it's totally counter to what your doctor's telling you? So it is very interesting. And a lot of it has come down to, of all the challenges, that are up against people wanting to receive the vaccine, the vaccine's safety is far greater than the virus itself and its impact on your body. So as someone who's had it, I can tell you that the things that I might worry about in a vaccine are far overshadowed by the after effects of having the virus.
Yeah, my hope is that as we start to dive more into the COVID-funded project, we'll be able to start really combating and getting messages out there through various outlets. It's funny, I'm definitely not the typical age group, but being on things like TikTok now and seeing influencers there that are epidemiologists suddenly join, like epidemiologist Kat, and there's a couple other doctors and epi people that have really strong platforms there, and they try to get the right information and then walk through the data in less than a minute for certain generations to understand what's going on. And I'm waiting for her next one on the AstraZeneca vaccine and why they stopped that trial. But it's really interesting to walk you through it, but making it accessible in a way that people can hear in a very consumable manner that is relevant to them from people that look like them is so important.
Right.
So.
Awesome. And then we have time for one more question, and then maybe we can close it out with ways that people can get involved with GHC3. But are other states using your playbooks and just customizing it to their regions and communities, or how are you spreading and disseminating your information?
Yeah, so the playbook right now is available on the NIH's website. So any state that wants to use it has it there. We've vetted it with several different states: Illinois, Ohio, Georgia, obviously Florida, and California, to look at, what are some of the challenges that the school of different sizes might have. So we chose wisely a underprivileged, under-resourced school that really had challenges in getting the mitigations in place, so that the public school systems in other parts of the country and private school systems really had more resources to move this forward and hopefully make it a good example for them. But promoting is important, and we work with Core Response and RADx, the division of the NIH that put out rapid test kits, to really get tools in the hands of organizations like schools to reopen safely. And what was the other part of that question? Oh, how to get involved.
Yeah, how to get involved.
Right.
Oh, that's
so there is a lot of information on the CDC website. I know it's big and daunting, but in it there are sections of appropriate messages to share, retweeting from the CDC, getting messages to you and your network about vaccines. Your experiences with them are always welcome and help spread the word. for us. Anytime that you can tie into our social media pages, and there's a lot of information on our website, globalhealthc3.org. We have a podcast also that you can have a listen to. Spike and Surge, the Pathogen Brothers. Dr. Bryman and I talk to public health experts from around the world about everything from vaccines to outbreaks to antimicrobial resistance, you name it. And we have guests from the CDC on there as well. So moving those forward, as you know, if you like them, comment and pass it around to your friends. The more information that's out there, the better.
Yeah, and I would just add, you can sign up for our newsletters too. We have a variety of them. I would say for the College of Public Health, the most relevant one, and we would get it to the GHC3 newsletter when they start theirs as well, but go to gghalliance.org, the Global Health Alliance's website. Emory is a founding member. They're also a member of Georgia Bio. We will communicate across both those groups in order to about events. On the global health one, I promote everything from our events here locally to global important global health events that are communicated through us. We hold policy roundtables and things like that. So additionally, we're hoping in the next year to build out a more robust career center. I think that's important for me to say. We always do our best, even just in my Georgia Bio capacity, to support the Rollins Career Fair. I know that's probably one of the strongest career fairs in the state. And quite frankly, I probably have at least 3 one-on-ones with students a week, whether it's from the School of Public Health or a bioscience student within any of our research universities, just to talk about them, talk about careers, especially those that may want to not end up in academia and end up in the private sector, just to talk through things. So, and Agnes, yes, we're very happy we chose KIP too. I think it's been a great relationship. And one of our former team members was able to connect us with the KIP, and that network's been really valuable. I just end by saying, you know, take the opportunity when we host events. We just launched the Women in Global Health chapter for the state of Georgia. That's something that women and men and anybody else, however you identify, can certainly join by signing up at the Global Health Alliance website as well. And if you get the opportunity to hear Judy Monroe at the CDC Foundation or Dave Ross, the Task Force for Global Health, talk about public-private partnerships, their experience is vast in the space for the public health side, and I would encourage you to listen into any of their conversations. They're very active on social media right now too. So look at those programs, look at those opportunities just to listen and learn, even if it's in the background while you're studying.
Maria, Ken, thank you very much. That was fantastic. I will pass it over to Michelle or Diego.